if we don't act proactively to have stricter measures, we may find it's too late.
As teachers advocates push for the ability to ramp up school safety protocols, BC's top doctor says nothing is stopping them from doing that.
There is absolutely flexibility.
We've had a 31% increase in the number of applicants for our undergraduate program.
Future students are still interested in pursuing careers in healthcare, despite the physical and emotional tolls frontline workers are facing through the pandemic. Just ahead, why there's a heightened demand for these programs.
They risk their lives to care for those people who we serve.
British Columbia is recognizing seniors care providers with an official day during a pandemic where so much has been asked of them. Just ahead, we hear from the people who take special care of some of our community's most vulnerable.
559 new cases of COVID-19 and 1 death were reported today in BC. The 1 death and all new cases reported today were from outside a long-term care setting. A development Dr. Bonnie Henry says illustrates how effective vaccines have been so far. The province has issued almost 224,000 doses of vaccine and almost 59,000 second doses. The vaccination program has so far been focused on residents in long-term care, but Dr. Bonnie Henry says the province is set to begin immunizing seniors.
We are now turning our focus to people over age 80 in our communities around the province. These seniors and elders will receive vaccine information in the next 2 weeks. So please be patient. We have not forgotten you. These plans are in place, and we will be reaching out to you in the coming days and weeks.
She added that more specific details on vaccine distribution to this cohort over 80 will be available on Monday.
With multiple Metro Vancouver schools seeing exposures of a more contagious COVID variant, teachers advocates continue to call for the option to implement stricter health measures in certain school districts.
Our concern is that if we don't act proactively to have stricter measures, we may find it's too late.
That concern prompting calls for the BC government to allow school districts with variant cases to ramp up COVID safety protocols beyond provincial guidelines. On Monday, the education minister was asked if she would support a district-by-district approach to school COVID measures.
We need to let this process unfold and find out precisely what happened, I think, before we have enough information really to go on with respect to what happened.
The lack of a clear answer not sitting well with teachers advocates.
My response was one of frustration because I think there is an opportunity to send a clear statement to parents, everyone working in schools, and to students that yes, if districts who are closest to the situation think extra measures are needed, we will support them and work with them on doing that in a way that makes sense.
But during her Tuesday briefing, BC's top doctor said provincial guidelines are just a baseline that can be modified.
By the school superintendents, by the principals, by the teachers in each individual school, depending on their physical layout, everything from ventilation to the numbers of kids in the classes, the types of classes that they have. So it is individually tailored.
Surrey School Board trustee Gary Tind agrees, but points to money as an impediment. He says it cost the Surrey School District $2 million to secure masks for its more than 130 schools.
I think the provincial government need to step up and provide enough funding to all the school districts, not only Surrey, so we can do something extraordinary to prevent our kids from this virus.
What remains unclear is whether districts have the power to make masks mandatory for all students.
We want to ensure that we can do whatever is possible to keep schools safe.
So instead, the Surrey Teachers Association is asking parents for help.
We've recorded a number of videos in different languages directly to parents in the community saying, please send kids to school in masks.
A call for mask use beyond the provincial mandate to prevent transmission of the more contagious COVID variants. In Vancouver, Travis Prasad, City News.
Normally we get somewhere around 500 to 600 applications. This year we had 860 applications.
While nurses and healthcare workers continue to deal with the emotional and physical demands of working during the COVID-19 pandemic, nursing and healthcare programs across the Lower Mainland continue to see high demand.
So we've had a 31% increase in the number of applicants for our undergraduate program. and we've had a 54% increase in the number of applicants for our nurse practitioner program.
Generally speaking, we have 3 applicants for every seat that we have. And that hasn't moved. It hasn't changed.
Part of the reason is that the pandemic has highlighted the extent of what healthcare professionals actually do.
The visibility of nurses and other health professionals during the pandemic has given people an opportunity to see this is nursing, and it doesn't necessarily fit the stereotypes of what you see on TV.
Another reason for the increased amount of applications is the changing economy and the desire for job security.
Potentially the economic downturn because of the pandemic, with so many businesses needing to be put on hold or people becoming unemployed as a result. Looking at different professions, nurses were employed, and we recognize that we always need healthcare professionals. So I think that's also spurring people's interest in terms of job security and the importance of a profession that's meaningful.
While it's good to see a growing interest in healthcare professions, the BC Nurses Union explains there's not enough nursing program seats to keep up with the demand.
Currently, we are not providing educational opportunities for enough nurses in BC to replace the numbers of nurses that we know will leave the profession.
The BC Nurses Union would like to see a better plan to retain current staff and recruit enough new nurses to fill vacancies.
I think it's important for the government to be concerned about the mental health of nurses and how we will support those who stay in the healthcare system. They do need to look at ways to incentivize nurses to stay, but most importantly, they need to look at how they recruit enough nurses to care for the patients in this province.
And the COVID-19 pandemic has highlighted just how important nurses are in public health care.
They need support from the public, they need support from the government, and that is investment in nursing education and nursing practice across this province.
In Vancouver, Murata Fatour, City News.
A teacher at West Vancouver's Mulgrave School has been arrested and charged with 1 count of possessing child pornography. 53-year-old Luke Lawson was reported to police in September. He must follow several court-imposed conditions, including staying away from children under the age of 16, parks, and elementary schools. Police say they worked closely with the school during the investigation.
Given this person's position of authority in a local school of ours, it was important to us that we reached out immediately to connect with the school administration, which we did. So we worked diligently with them from the outset in order to conduct a really in-depth risk assessment to ensure that nobody at the school especially, as well as the greater community at large, was at risk.
Lawson is set to appear in court next month. Thousands of TransLink employees are learning more details about which parts of their personal information was accessed in December's hack. While there were initial suspicions workers had their data breached, employees are now receiving confirmation that that actually happened. In letters, TransLink informs each worker which parts of their data was copied by the cyber crooks. One employee was informed their social insurance number, home address, bank account, and date of birth are now in the hands of hackers. TransLink is providing credit monitoring for 2 years, but the president of Unifor 111, which represents bus drivers, is pushing for at least 5 years. The province has announced changes to help restaurants and bars survive COVID-19. A temporary move in June, letting the hospitality industry pay wholesale liquor prices, has now been made permanent, though consumers may still pay the same price for a beer or cocktail while dining out. 80% of the industry that employs 190,000 workers across BC has reported losing money since the pandemic started.
Without them, we wouldn't be able to continue to care for the seniors in those settings.
The COVID-19 pandemic has hit seniors' care homes the hardest, and now British Columbia is recognizing the people that care for our community's elders with an official day.
This has been the most challenging time for a nurse in their nursing career. It has been stressful as they have watched people unfortunately become sick and pass away, but also as they have faced their own illnesses and worry about how it will impact them.
The provincial government has proclaimed February 23rd as BC Seniors Care Providers Day. It's a day that celebrates care aides, nurses, frontline and administrative workers who look after BC's older adults.
But I think the recognition goes beyond a day.
Queenie Chu is a nurse and also the CEO of Success, which manages a number of seniors care facilities like Simon K. Wiley Seniors Care Home in Chinatown and the Austin Harris Residence in Richmond.
This is important for us to express how much we appreciate them in, providing those extraordinary care and compassion for the seniors. And the work is phenomenally heavy.
Staffing shortages and overtime hours continue to weigh on the shoulders of senior care staff, even before the pandemic.
Well, it's unfortunate, but nurses have faced chronic understaffing, heavy workloads in long-term care for a very long time. And it only became much worse during the pandemic, certainly as people became sick themselves and were unable to work and had to take extended periods of time off.
To give you a picture of the demand for long-term care, a report by the BC Seniors Advocate says the average wait times for people admitted to long-term care have increased by 37%. That's 52 days. The average time spent just sitting on the wait list is 133 days. These figures from 2019 don't include the serious impacts of COVID-19. The single-site order put in place for the pandemic that stops care staff from working at multiple facilities makes things even harder.
And so we do need the government to look at the staffing models and ensure that the nurses have the physical and the mental health supports they need so that they can safely practice going forward.
BC care providers put together video messages from several prominent healthcare leaders and media members and encourage family members to share it on social media to show their support for senior care workers. In Richmond, Kier Junos, City News.
Vancouver's news is always available on the radio with News 1130 or online anytime at citynews1130.com. Your next edition of City News is tonight. Thanks for watching, and I'll see you then.